Good afternoon, everyone. Thank you so much for joining us this afternoon for our webinar, which is going to be focusing on answering questions related to the vaccine. We know that there are a lot of questions out there about the vaccine. Or is it safe? Is it effective? How was it developed? Have there been any side effects? And so we are so pleased this afternoon to have Dr. Jim Wright join us. He is the medical director at Our Lady of Hope Health Center in Richmond. He's also a founding member and attending physician of the SNF Long Term Care Partners of Virginia in Richmond and is a member of the Governor's Long Term Care Task Force. And we are so fortunate to have him this afternoon to provide us with some information and to answer your questions. So thank you so much, Dr. Wright, for joining us today. I'm going to hand it over to you. Dr. Wright, I think you need to unmute yourself.
That was strange. Okay, I'm muted.
We can hear you now.
You can hear me, right?
Yes, we can.
You just can't have a talk nowadays without accidentally muting yourself. So thank you, Dana, for inviting me to speak to all the leading age members and associates today. I understand there's a wide array of interested parties on the talk. So what I'd like to do today is give you some background on the vaccine. Of course, my interest will be in interesting you in receiving the vaccine and encouraging others to do the same. But I'd like to preface this talk by saying, those of you that are on the fence about accepting this vaccine or consenting for a loved one, this talk is for you. Those people who have decided that no matter what, they're not going to take the vaccine because of what they heard from their friends, neighbors, or on Facebook, I don't really have much to offer you. So I'm hoping that those that are on this talk and in the audience are going to listen to what I have to say with an open mind. I am a scientist and a physician. I have a PhD from VCU. I studied brain cancer research before I went to medical school. So science is very important to me. And in the 25 years of my practice, I have practiced evidence-based medicine, I think, with good success. And so I've learned both through my training and experience that science is important. Science is trustworthy. And it's really I'm a cynic. And it's really the only thing I trust when I'm making medical decisions for my patients and for myself. So that's where I'm coming from. And let's hope we can walk away from this talk with a lot more knowledge, reliable knowledge about the vaccine, and hopefully with a more confidence in accepting the vaccine. So I realize that vaccine hesitancy is real. Hey, this is new, right? I mean, this is a different type of vaccine that none of us have received before. Actually, before December and January, none of us had received it. So there's concerns. It was developed really quickly. Were there any steps skipped? Were there any safety features that were discarded in the making or the testing of this vaccine? What are the side effects? What's going to happen when we receive the first shot or the second shot? And is it worth it? Is it effective? So we're going to address some of those, hopefully all of those. The studies show that actually less than 30% of nursing home staff are going to, or say they're going to accept this vaccine. 28% actually. That's really, really low. And the way I like to think of this is World War II for us. By the end of this pandemic, as many Americans will have died of COVID as died in World War II. We are potentially nearing the end of the war. And science has given us a weapon to use that will decisively defeat the enemy. Science has given this to us. Science can't use it for us. It is up to us to use the weapon and end the war. It's the only way we're going to get COVID out of our lives and out of our facilities. So I want to hopefully bring that number up from 30% to what we need, which is about 70% vaccine acceptance to really get rid of COVID. What are the pros? Well, first of all, you're not going to get COVID if you take this vaccine. It's 95% effective, which is just incredible for a vaccine. By way of comparison, the flu vaccine that some of us get every year is considered a good vaccine. It's 40 to 50% effective. So a vaccine that's 95% effective in defeating or protecting you against COVID, you simply are not going to get COVID. So that's number one. You are not going to pass it to your family. So those of us who work in healthcare and are on the front lines and come in contact with COVID every day, sometimes we know it, sometimes we don't. Sometimes we're talking to a coworker who has COVID. Without this vaccine, our families are at risk. And so protecting our families is a really good reason to get the vaccine. But protecting our residents, they're the most frail members of society. The death rate amongst elders in nursing homes is the highest in any group in the world, 20%. And will also help stop the spread through the community and help to open up society again if we get this vaccination. I'd love to stop wearing masks. I think you can probably see the lines on my face from the mask I was wearing a few minutes ago. But also, whether you realize it or not, you work in an industry that is based on science. So in some way, we all are scientists. And if we scientists don't accept the evidence that our whole occupation is based on, then we're a very poor example to the rest of the community. So scientists like me, scientists like you, need to look at the scientific data and make a good decision about this. So these are some of the questions that folks have. Is it safe? Is it effective? Why should we trust it? Is there new technology being used, and is that dangerous to me? What is an EUA, an emergency use authorization? What does that mean? How long will I be protected? And when will that protection start after I receive the vaccine? Will I still need to wear a mask? What are those side effects? What if you've already had COVID-19? And where can I find accurate information? So let's look at the two different vaccines that are out there. Most of us that are receiving vaccines are receiving the Pfizer vaccine. Moderna has been released relatively recently, but most people are getting the Pfizer vaccine. I received mine about a week ago. The studies that were done on these vaccines involve 65,000 people. So as far as numbers go, before the first vaccine was given in a clinic in a nursing home, 65,000 people had already been enrolled in the study. About half of them had received the vaccine. So over 30,000 people had already received the vaccine, and we're probably up to greater than 100,000 people have received the vaccine in America, more than that worldwide by now. So about half of those people in the Pfizer study were over 55. 30% were racially diverse, 10% were African American, and 13% were Latino in the Pfizer study. And the results were incredible. So they gave the injection, it's 2 injections. For the Pfizer one, it's 3 weeks apart. So they gave the injections and they looked at what happened to these volunteers. So again, it was for the Pfizer study, it was about half of that, 20,000 people in the Pfizer study. So 20,000 people got the vaccine and they set them loose. They didn't expose them knowingly to the virus. They just set them loose in the community. And they found out that those that came in contact with the virus, only 5% of them, after that second dose, only 5% of them came down with any symptoms at all, any evidence of infection. These volunteers were tested on a regular basis. And most of those volunteers that did catch the virus had no symptoms at all. They found out that after the second dose, 7 days after the second dose, you are fully protected. But after the first dose, about a week after the first dose, you start getting some protection, about 50%. That's where I am right now, which I can tell you is a really good feeling. But as you go farther from that first dose and after you get the booster shot, your protection grows. They looked at side effects. And people did get side effects, but the side effects were mild. And what we're talking about are the side effects you have already experienced after getting a flu shot. I had a sore arm the day of my injection and the morning after. I took an Aleve, and it was really helpful, and that was it. I did not have any other serious side effects. Some people did have some fatigue. Some people had headaches. Those side effects were a little bit more pronounced after the booster shot, but all in all, no side effects that cause people to miss work if you took Tylenol or Motrin or Aleve that took care of your symptoms. So really minimal side effects. And you got to think about the benefits. So we're going to talk about balancing risks and benefits later in the talk. Are they safe? So we do know from the studies that we have done, and this vaccine has been under development for a year, and it's been studied for months in probably 100,000 people now, that there are no dangerous side effects, although there are side effects. So with vaccines, as we've seen throughout the history of vaccines, most side effects occur within the first 6 weeks. The FDA requires 8 weeks of safety monitoring. That was done in those original studies, and we have a lot more data now, and we have not seen any dangerous side effects. So they are safe, and the data is good enough to allow the FDA to release this vaccine. This vaccine did get approval by the FDA. It used the same standards that it had, this COVID vaccine had to meet the same standards that all other vaccines have had to meet. We'll talk about why it was so quickly developed. Instead of the usual 4 years for a vaccine, this COVID vaccine came into existence within 1 year. Let's talk about what the vaccine is, though. And this is important. And as a scientist, I find this really interesting. So this is called a mRNA vaccine, messenger RNA vaccine. What this does is that instead of like breaking up the virus and injecting it into your arm, that some vaccines have been like that. This contains no virus whatsoever. What it does is it gets injected into your shoulder. And let me see if I have a picture here. And this mRNA, messenger RNA, this little squiggle here, gets injected into the muscles of your arm. The messenger RNA goes into your cells in your muscles, and there's something called a ribosome. It takes the information from this messenger RNA and it makes a protein. And that protein is this little red spike here. So it makes the spike protein, causes your cell to make the spike protein. Spike protein gets released into your bloodstream, and it causes your body to produce antibodies. So what's going on here is that it's causing your body to mount an immune defense against the virus without having to get infected by the virus. All your body sees and all it needs to see is this spike protein in order to create an immune defense. And I like to think of it as a suit of armor. Within a week after that second shot, your immune system has basically produced a suit of armor to protect you from getting infected from this virus. And so it's important to know that despite what some people might think, this is material that helps your body to make a new protein, but it doesn't get into your genetic material, okay? It doesn't get into your DNA, does not change your DNA, doesn't get into your DNA. Your DNA is here in the nucleus, in your cells. This stuff stays outside in the cell space here. So that's how it works. The approval process, the emergency use authorization. This is something that the FDA does when it has a very dangerous disease and an effective treatment. It allows the treatment to get out for use sooner than usual because of the emergency of the situation, the urgency of the situation. But the EUA, even though it's shorter, the same safety processes are put in place. Nothing was skipped to get this vaccine out into the community. And on December 10th of 2020, they approved it after looking at all the data and those studies that I showed you, and decided that given the benefit of the vaccine and the effectiveness of the vaccine, given the low probability of any serious side effects, and given the deadly nature of this pandemic, it was time to release this vaccine. And the reason why it got to the EUA so quickly, again, was not because steps were skipped. It was because all the countries around the world really got together, put a lot of money and scientists into this one particular problem, and were able to develop the vaccine. The other thing to know is that this is actually not a new vaccine. The SARS virus, that bird flu virus, that's a coronavirus as well. The same type of vaccine had already been developed for the SARS, the bird flu virus, just about 3 or 4 years ago. So the technology was already there. They just had to make a quick pivot to help address this particular virus. So we had some basic information already in place. Thank God we were able to devote the money and the resources to it to get where we are right now. Again, science has done an amazing job giving us this weapon to defeat this terrible enemy. It is up to us to do the rest of the work. So the vaccine, again, the Pfizer vaccine is given 3 weeks apart. The Moderna vaccine is given 4 weeks apart. 2 shots, you got to get both to really be protected as far as we know. It looks like, well, I can tell you from the studies that I've looked at, 1 week after that second shot, that's when you get that 95% protection. How long does it last? We don't know. We will know because studies are ongoing right now. We hope that the vaccine will last for years and years and years, and we hope that COVID-19 is not something that's going to be around very much longer. However, if not enough of us get the vaccine, it's going to hang out there in the community, just like mumps and measles, and we'll have to get boosters and keep on getting these shots. So we'll see. Will you have to still wear a mask after the vaccine? Yes. And the mask wearing will go on until coronavirus disappears. So as long as it's in the community, and it certainly is in the community right now, Henrico is up to 10.5%, I believe, in prevalence now. As long as we see the coronavirus in the community, you're still going to have to wear a mask. However, coronavirus, again, if we all get the vaccine, it will disappear. We'll be able to stop wearing masks. Let's talk about the side effects again. So what the study showed and what we've seen in these vaccine clinics that have been going on: headaches, muscle pains, fatigue, chills, maybe a low-grade fever and pain at the injection site, maybe 24 hours, rarely 48 hours. It's important to know, just like we were talking about, this vaccine cannot give you COVID. All it does is tell your body to make that red little spike protein. Your body doesn't know how to make the virus. It's not going to figure it out because it doesn't have the information to do so. So all it's doing is making that red little protein, that spike protein, that your body forms a defense against. So, when you get a side effect like a sore arm, when you get a little headache or you're fatigued, what that means actually is that it's a good take. The vaccine is taking. It means your body is working hard to produce the antibodies to protect you, to make that suit of armor to help protect you. And a good reaction against the vaccine means you're going to be really well protected. And then it's just important to know, you got to come back for the second dose, okay? Don't miss that second dose. You got to get the booster shot to get the full protection. What if you've had COVID? Get it, because even though we know you're going to be protected for at least 3 months after you're infected, there are still cases of people getting reinfected with COVID. So, what we're hoping is that this vaccine will give you longer lasting protection. And so, even if you've had COVID, go ahead and get that shot. Now, I do know for a fact that CVS has a protocol that says if you've had COVID in the last 2 weeks, you can't get the shot. So, you'll have to wait until they come around again for their second and third visits. But there's no danger. Let's say you're asymptomatic, you tested negative the day the vaccine clinic came through and you got your shot, you turned positive the next couple of days or so. That's not going to be dangerous for you. It's just that CVS and Walgreens, they don't want to give a vaccine to someone that's already got a fever, already feeling bad. So get that vaccine even if you've had COVID-19. And finally, this is really important. So there's a lot of information about coronavirus, vaccines in general out there. You can go on a never-ending quest to read all there is to know about coronavirus and the vaccine. But I can tell you most of that is garbage. Again, I'm a skeptic, and I really demand a high level of evidence before I believe anything when anyone makes a claim about a medication or a disease. And the CDC are skeptics also. And so if you want to find good information from people that really comb through the data, you go to the CDC. That's a really good place to look. And if you simply Google CDC and COVID vaccine or CDC and coronavirus, you're going to find reliable information that you can depend upon. I can't promise that if you look at anywhere else. I will say the WHO, the World Health Organization, also has good information about COVID and the vaccine. So try to, and this is what I recommend for my facilities as well. Since the beginning of this pandemic, I said, well, we're going to focus our data collection on a few sites. The Virginia Department of Health, the CDC, the WHO. If it's not in there, we're not going to act upon it. And that's served us well for the past 9 months and the 2 corona outbreaks I've been through. And I'd like to just, again, reiterate, this is for any of you that are looking to convince others and encourage others to accept the vaccine. There's a few ways to frame this discussion. Again, think of this as your war. This is your war. All of us in healthcare, at least I hope, will never have to go through anything like this again. We have never been through anything like this before, at least in this country. This is your war. And if you're going to fight the war and if you're going to defeat the enemy, you have to take this vaccine. That's the only way the enemy is going to be defeated. So please play a role in fighting the enemy. Step up, roll up your sleeve, and get that vaccine. But I also recognize that all of you, I don't know of any facilities that are requiring the vaccine. There may be some, and I have no problem with that, but most of our partner facilities are leaving it up to you, which I think is a good idea, because only you can weigh the risks and the benefits of this vaccine. But I want you to think of something when you're weighing the risks and the benefits. So again, what's the risk? Well, you're going to get a sore arm. You're going to get a low-grade fever, maybe some fatigue. What are the benefits? Well, you're not going to catch COVID and perhaps die. You're not going to pass it to a family member who might get sick or even die with COVID. And worst of all, you're not going to pass it along to your frail elders that you have said that you're going to protect and serve. So that's a lot of benefit for a little bit of risk. Don't let the risk prevent you from getting the benefit, because you do this in everything you do. If any of you drove today, you already said to yourself somewhere in your mind, okay, I could get in a car wreck. I could even die. But the risk of a car wreck is so low, and the benefit of me getting to work and having a job is so great, I'm going to go ahead and get in that car. So you weigh risk and benefit every day. try to just remember that just because there's a risk doesn't mean that's the end of the discussion, because you assume risk in everything you do every day. So look at the risk carefully, look at the data carefully, and weigh those risks and benefits for yourself, just like you do with everything else. And I hope that those benefits for you will far outweigh the risk. And I didn't finish this sentence here, but the contraindication to the vaccine, I'm sure you all have plenty of questions about that. The contraindication, or the only reason to get the vaccine, is if you're allergic to any element of the vaccine, which is, if you've had this vaccine before, is what the CDC says, and you've reacted to it, don't get the second vaccine. No duh. But really, there's no other actual prohibitions against getting the vaccine. So even if you had reaction to other vaccines, you can still get this vaccine. This is a good vaccine. You shouldn't let anything get in your way of receiving it. All right, so that is the end of my presentation. I will turn it back to you, Dana, if you have questions.
Yes, thank you so much. Wow, Dr. Wright, that was so informative, and we're getting comments in the chat box about how great that was. So thank you. We do have
Great.
quite a few questions. First, what information or reassurances can you give for those who are breastfeeding? What
Yeah,
I'm reading online says that they have no data trials of the
right,
subpopulation, so nothing can be 100%. But
that's
are
right.
there general science-based reasons to believe the vaccine is safe and will not harm the
Yeah.
nursing baby?
Right. So there are reasons to believe that it won't hurt the nursing baby because of other viruses like this before. What the CDC says is there are no studies in pregnant or nursing women at this time, or results are not out yet. Those studies have just started, actually. Um, but they also say if you're a childbearing age, even if you're pregnant, weigh the risks and benefits for yourself. There's no prohibition against getting the vaccine because we have seen pregnant women get vaccines before that actually protect their infant. And so, even though I will say, yes, we don't know exactly if there's any risk because studies have not been done, studies have not been completed, I can tell you that there is risk to your fetus if you were to get sick with coronavirus. And so the risk to your fetus from the disease is high. The risk from the vaccine is low. And so if I were weighing the risks and the benefits, if my daughter were pregnant and asking me whether she should get the coronavirus vaccine, I would say yes, do get that. So.
Thank you. The next question, what if you have food allergies and environmental allergies?
Right. So that's not a contraindication either. We've not seen any cross reactivity between food allergies or penicillin allergies. Even if you have an anaphylactic reaction to penicillin, anaphylaxis means hives and trouble breathing. We've not seen that be a problem in studies in people receiving the coronavirus.
Well, that's a great lead into our next question. Any guidance for those who have had anaphylactic reactions to particular medications previously?
Get the vaccine because if you're sick with coronavirus, you're likely to get a lot of medications and potentially react to those. The vaccine clinics are attended by pharmacists. I actually attended our vaccine clinic and hung around to watch. I've actually been at a couple with my toolkit for anaphylaxis. I've not had to use it, but the people at the vaccine clinic will be observing you for at least 15 minutes if you've had no history of anaphylaxis, and 30 minutes if you do have a history of anaphylaxis. They have the EpiPens there, they have the Benadryl, and so they will be able to treat you if you do have it. But so far, we've not seen that as a reaction.
Thank you. The next question. So, a member was on the CVS webinar regarding the pharmacy program. They said if you're COVID positive but are asymptomatic, then you could still receive the vaccine. So, are
Mhm.
you saying you should wait 14 days before receiving the vaccine?
Well, that's what their protocol says. So if anyone has had the consent form, if you look through it, it says if you've had COVID within the past 14 days, you can't receive the vaccine. That is not anything that's supported in the literature or the studies. The fact that you have asymptomatic COVID infection is not going to change your reaction to the vaccine. It doesn't increase your risk of becoming sicker from COVID. So I would encourage you, if CVS is saying, forget about what we said on that piece of paper, go ahead and get your vaccine, I would encourage you to do so, because there's no scientific evidence to suggest that you're at risk, even if you're infected with COVID, by getting the vaccine.
Next question. Can I carry the virus when I get vaccinated and infect someone who does not have the vaccine?
The only way that could happen, so first of all, you will never get the virus from the vaccine. You will never shed the virus from the vaccine. But like I said, you're only partially protected until a week after that second shot. So let's say me, for example, I received the vaccine a week ago. I'm like 50% protected. I can still catch it and I can still shed it. Probably for another 2 weeks, 3 weeks at this point. So you still have to be just as cautious in potentially spreading the virus until that week after the second shot. Now, it's not that you shouldn't sanitize your hands and wear a mask after that, but you're at risk for passing that virus and catching the virus until 1 week after the second shot.
Could you comment on the vaccine's effectiveness regarding the new strains that we're hearing about?
Yeah. So there's no good studies that show that it's effective, but the scientists who developed the vaccine, and they know all about the spike protein, they do feel at this point that the spike protein is the same. So fortunately, the vaccine picked the right thing to protect us against. And so the spike protein on the original coronavirus is close enough to the spike protein on this UK and South African strain to offer us the same kind of protection. That's what we think.
Great, thank you. Do you see this vaccine turning into an annual vaccine similar to influenza?
It will, if not enough of us get it. So in order for us to drive this vaccine out, or virus out of the community, over 70% of us have to get the vaccine. 70% of the American world population has to get the vaccine. That's a pretty tall order. So it's all up to us. I mean, if we're all like gung-ho and encouraging others to get it, we won't have to get this vaccine again. So we'll see.
Of the Pfizer and Moderna, is there a better vaccine in your opinion? That was the next question. Which is the better vaccine?
They're both as effective. So one's like 94.5 and one's 95%. So they're both just as effective. And even if you look at the studies, even that, the 5% that still caught coronavirus, they were basically asymptomatic and had minimal shedding and minimal infectivity. So either one is good. The advantage to the Moderna is that it doesn't have to be frozen at the low temperatures that the Pfizer does. And so that might be a good vaccine to get at your doctor's office. Most doctor's offices don't have those ultra cold freezers. So if you get it through your doctor's office, it very well could be the Moderna vaccine, just as good.
Well, Dr. Wright, we do not have any other questions that have come into the chat box, but if it's okay with you, I would just like to offer anyone to come off of mute to ask any questions.
Mm-hmm.
If you have any questions, just take yourself off of mute. This is just such a great opportunity. Probably not a lot of questions just because it was so thorough.
I have a question. This is Leah Frage, and I understand that for the world, for everybody to get vaccinated, at least 70%, which is a tall order, and it's going to take more than a year, definitely.
Yeah, I agree.
So with all of us traveling and being so mobile, it seems to me that the protection the aim and the hope that we will all be protected is going to be slim because of just the travels that
Yeah,
are happening.
true. Although some vaccines do offer, 10-year protection against bacteria, even the tetanus diphtheria shot. So,
Uh-huh.
yeah, I mean, even though it's going to take, let's say, years to get everyone vaccinated, a year from now, we may find that your protection from the shot you got back in 2021 is still just as good. So, it depends on a number of things. You're right. So, the presence of coronavirus in the community, the duration of benefit, will it be a yearly shot? Will it be every 10-year shot? Yeah, I don't know.
Thank you so much. And
Yeah,
I pray that the effectiveness will prove to be a long term because we really need to move forward. I
we do.
appreciate it.
We do.
Thank you.
Tired of Corona.
Thank you, Leah. Any other questions?
Yeah. Dana?
Well, yes.
Hey,
Yes, Lisa. Yes.
yes, hey, we have one, Christy and I. So how, Dr. Wright, how are they testing for the immunity?
Yeah, so it's the antibodies that they test. There's something called neutralizing antibodies. So they want to see a particular antibody that's directed against the spike protein, and they're simply measuring the levels in the blood. So that's how they did it with the Pfizer and the Moderna studies. The data about how long this vaccine lasts, that will come in the same way. So I don't know how often they're going to be drawing blood on volunteers, but it essentially would be anyone that receives the vaccine could be in this study, for example, and you could get blood drawn, let's say monthly or weekly for a little while, for years, so they can watch the amount of protective antibody in your bloodstream. So that's what they're looking for. And that does work. You have a certain level of protective antibodies, you're not going to get infected. That's how they'll look at it.
So it could be a while.
Yeah, but the good news is, those studies are months ahead of when we're receiving the vaccine. So, we'll receive updates in the press through the CDC that says, yep, you're still protected at 6 months. Yep, you're still protected at a year. Or, hey, you need to get it again. So we'll have plenty of advance notice as to whether we're protected or not.
Okay, thank you.
Sure.
Any other questions? Well, Dr. Wright, we are receiving a lot of comments. Thank you, Dr. Wright. This was awesome. Thank you. This was great. We will be providing a recording of today's webinar in our update, as well as on social media. So we really encourage you to share it with residents, families, and staff. And I just want to thank everyone again for being on today. And thank you, Dr. Wright, so much. This was extremely
Thanks for having me.
helpful.
Always a pleasure. Thank you.
Thank you.
Everyone stay